Okay, so for my students, this is a chapter review. For anybody else out there, if you're interested in school nursing, you're more than welcome to listen. I hope you enjoy. I want to start out by saying thank you, school nurses. You, after reading this chapter, teaching this piece, I just want to say thank you because you do so much. I don't think people realize what all you do. So kudos to you and thank you. So let's get started. There we go. School nurse roles. One of the things that they have so many roles. That's why I'm saying you don't really realize what a school nurse does until you look at this and think about this. They're case managers, and I've given kind of little definitions of what each are. So coordinating the healthcare for children with complex health problems. They reach out, they coordinate with the physician, with respiratory, with parents, with other resources out there that can help them. Consultants, they are considered consultants, and they will be brought in to consult on different things, exactly what it says. Can offer professional information about proposed changes in the school environment. They ask the school nurse, they're getting ready to build a beautiful playground, and they want to put a big jumping something out there, and they ask the school nurse, and she is consulting them to say professionally, probably not the best idea because injury is one of the biggest problems and causes of death for children at this age bracket. We need to be safe. So she would give her professional opinion. She can use evidence-based research to support it. And she is, though, considered a consultant. Counselor. This is big, and I have mixed emotions about it. It is what's there. I think we have to be very careful, but we as nurses, people trust us, people believe in us, people want to come and talk with us about things. We provide a safe environment to talk about mental health issues. But one of the things that I think people should understand is that if someone brings to you information that the student themselves or another student or someone in their family is being harmed or could be harmed based on what's going on, it is our responsibility to report it to the authorities and the powers that be. It is important. It goes all the way back in. If we're in an emergency room, if we're anywhere, if a child is being abused, we have to report. Same thing. Health educator. I love the 4 in my teaches. There's nothing there. It's nothing special. It's just a typo. Teaches individuals in classes. So not only do they health educate and go into the classroom to teach different health situations, issues, disease processes, preventative, thoughts. They teach individuals too, so they can do disease prevention and communicable diseases, but they can provide education with disease processes and management to parents and children who don't understand what's happening. And that happens a lot. I mean, I've never been a school nurse, but I can say this is that physicians can come in and speak, dietitians can come in and speak, therapists can come in and speak, physical therapy can come in, occupational, you name it, they can all come in on this patient or client, and they look at you and go, I don't get it. I don't understand. And as the nurse, we need to be able to help them through so that they can understand. The same with a school nurse. You might have a student or parents that don't understand, and you're there to help provide education to understand and be able to do what they need to do. But they also go into the classrooms and teach. They also can help teachers teach. So there's a lot of different roles there in the school. Community outreach is another role. Community health fairs or festivals in the schools promoting health through education. This is considered a role as a community outreach. So they're going to deal with providing education for healthcare issues. Healthy People 2030, if you go there and look, I mean, there's so many things out there. One of our biggest things is obesity, type 2 diabetes, cardiac issues, the same old, and uncontrolled type 2 diabetes is big. But one of the things is that this is an opportunity to promote health and health care through education at festivals, give out a pamphlet, have something. My class actually just did a great thing with a high school, local high school, and provided this would be community outreach. Researchers, they can be researchers. They do ethical and scientifically formulated research. So they're there. It's to also, when they're doing the research, they're there to protect the child. If the child is being used as a subject matter and involved in the research, they are ethically responsible to make sure that that child is protected, plus that there is consent for the child to participate in all of that. But they do research. They're trained to do this. It's kind of interesting because I find it the time consumption of this, but in the role of if something was going on and they could provide or create or collect data. So it's there. Direct caregiver. As the direct caregiver, the nurse assesses the seriousness of their complaint or symptoms. So you have a child that comes in vomiting, you're going to assess. We never diagnose. We're not giving medical diagnoses. That is a physician or a practitioner of some form, a healthcare provider. But we are assessing as nurses the symptoms or what's going on. So they're vomiting or whatever. Why? Did you eat something? Did you woke up with a stomach ache? Whatever. We provide care to stabilize a child in an emergency. The providing of the care, you're not going to, it's just like anywhere else. If somebody went down, the first thing you want to do is make sure that you're calling 911 so that an ambulance is on their way so that someone can actually handle the emergencies, has the tools and the skills or whatever to handle the emergency situation and then take it to the next level where it needs to go. So for the direct caregiver, we're going to try to stabilize. We have a child that falls down, we might, C-spine protection and apply a C-collar, have the child stay immobile as we're assessing to make sure that they're okay, not losing consciousness and that kind of things. Then as we've already called 911 for the paramedics to arrive or EMS to arrive and take over at that point. Providing first aid. If kids fall, cut their legs, scrape their legs, bust their little lips, things like that. Older kids can do the same, hit a block or cut their head, whatever needs to happen. We would assess the situation. If it's something that can be handled in a very simple first aid, providing pressure with a Band-Aid, cleansing the area from putting a Band-Aid, then we would do that as a school nurse. If it's something more and there's splash, we see, down into deeper layers and it looks like stitches or staples or butterflies need to be applied, then that's where we would assess, stabilize, keep it clean, cover it, and then send them to get whatever needs to happen in an emergency setting, like an ER. And then ongoing care of chronic illnesses like diabetes and asthma. Diabetes and asthma are mentioned here. We will go over diabetes and asthma a little further because they impact kids. They impact the children that are in school. So it's so important that we realize what we need to do as school nurses and what we're looking at with that. But violence, and that's something that we're hearing every day in the news. Violence, violence, violence. We're seeing it. We're hearing about it. It's huge. But as a school nurse, there are things that we can do to help hopefully prevent violence. And that would be encourage parents to engage in activities that promote connections with children, communication, problem solving, and different things like that. We want to encourage parents to engage in these activities. They're school activities. We want them to come. They are going to promote these connections. By doing that, then the child hopefully will, if there's violence going on, the child will be able to talk about it, or if they're feeling violent, they'll be able to communicate this, and then the right help can be given, and we can hopefully prevent issues from happening. Developing zero tolerance for any weapons on campus. There's no tolerance for a gun, a knife, any kind of weapon, anything that would be used against someone else as a weapon. It is zero tolerance, not going to have it. Not all schools have that. So as a school nurse, it's so important that we work towards pushing that to the forefront and making it happen for that school. Advocate for adult monitoring in hallways between classes. Bullying is huge. Bullying we see in schools, we see it of all ages. It's something that needs to stop. It needs to stop. It hasn't stopped. I have friends with kids that have been bullied, that they had to change schools. There's just so much out there. It's really sad, sick, and twisted. But the thing that we need to do is with adults in the hallways, things, students are passing through the hallways, getting their books, going to the next class. They're just there kind of keeping eyeballs on so that we can hopefully prevent bullying, violence, anything like that taking place, fights, stuff like that. Keeps things smooth flowing. I'm all about smooth flow. Developing mentoring programs for at-risk youth. This is great. They need mentors. The at-risk youth need to be identified, assessed, identified, and we need to get mentors involved so that we can hopefully interact and get these students that are at risk onto a path where they can be successful. Gun safety education, vitally important. Gun safety. I live in an area where guns are very prevalent, and the thing is to teach children, teach parents what to do if you have a gun and how to keep it safe and safe in your house. It's just so important that we teach gun safety across the board. No matter where you stand politically on guns, gun safety is always important, especially if you live in an area where there's a lot of hunting and things like that. And that's kind of where I live. So it's needed. And by teaching people how to handle guns safely, to keep and store guns safely, all that, we can prevent violence from happening. We can prevent injury, accidental injury from happening by doing this. So definitely important. Crisis intervention strategies to de-escalate a crisis situation and resolve conflict. As the school nurse, getting and providing crisis intervention strategies and in hopes to de-escalate a situation and resolving conflict. So there's different things that we can do. These intervention strategies are what are we going to do? What physically can we do, right? An intervention, and that's going to de-escalate. How do you de-escalate anything? One thing is to give an opportunity for someone that is in a crisis moment to be able to contact or reach out and find someone. Lots of times what we have found in our history out there is that the person that's in crisis is reaching out or looking or seeking, and when they just can't make that connection, then something happens, the next thing happens. So if we can do that, then we can hopefully prevent and resolve issue. Also too, lately, our college and the college that I attend right now, and many other colleges and schools out there are providing hotlines and ways to access. So not only the person that is having an issue, but someone that observes behavior or is concerned about another person can call and report. So maybe somebody can intervene and hopefully help this person. It's a great thought. I'm just hoping that it works. Okay, giving medications. Now, one thing as a nurse, we give meds. We give meds in the hospitals, we give meds in the clinics, we give meds. Well, guess what? School nurses give meds too. That is something as nurses we just do. The school nurse can give prescribed medications, but those medicines have to be in the containers they come in with the label on there from the pharmacy. It's got to have the student's name, the doctor, the directions, the pharmacy, and the phone number. Just it can't be you've made the label and put it on there. It has to be from the pharmacy with a correct label on there with the student's name on there specifically. Over-the-counter medications can be given, but the parent must give permission. So you can't just call up and say, hey, or the student can't just pop in and say, hey, I would like a little Tylenol, I got a headache. There has to be some consent. Lots of times the consent needs to be written. My children are all grown and adults now, but back then even we weren't allowed. You had to send the over-the-counter medication in with the note saying they can have this if, and everything's signed. Also, vitamins can be given if needed for whatever reason. This is something that I did put at the bottom of the slide, a current signed parental consent form got to have it with primary care directions. We need the doctor's directions on there and his approval. This is what I want given, and this is how I want it given. It must be provided before administering any medications to students. So it's not something by choice. It's not something that they can bring, in their own book bag and pull out and give themselves. It has to go through the school nurse, and we have to have a parental consent form signed with also primary care directions and approval. The doctor's got to say yay, the parents have to say yay, everything's got to be aligned before we give it. Let me back up one more thing. On this one, when we're giving medicines, the nurse also needs to make sure that she has a reference book to turn to make sure that she understands and knows what she's giving always. We're not dealing in a clinical setting where we have a system, a computerized system that they can click on, and it's going to say, you're going to dispense and give this amount, and this is what it's for, where they can get all that information. So they have to have that written book, something for to support, to consult for information. So it is so important that a current medication drug book should be at the nurse's office so they can consult for information. They needed something, it can't be 1986 when it's 2022. It needs to be current so that they understand, look the medication up before giving. School-based healthcare centers. I've never encountered these, but I read this and found it to be fascinating. They provide resources that most students can access, and by providing it in a pre-K through 12th grade, the student will miss, my English is very bad, I typed this up quickly, will miss little to no class time. So what's great about them is they provide resources. It's in pre-K through 12, so we're looking at the entire school system. But by having this, they don't miss class time. They don't miss school. They can go get their appointment or whatever. It's set up and it's done. Also, this helps parents. So if parents are having to work, if it's already set up, everything's signed, the student can go to whatever appointment is needed without the parents. And it's quick, easy, life is great. But the one sad thing is happening is these school-based healthcare centers are few and far between, and it's funding issues, and the sites on and off campus are decreasing. And this is a concern in health promotion. We are in a health promotion crisis in our country. And one of the things that's so vitally important is that we get the care that's needed, especially to kids, to children. And so if this is going away, then what do we have? If a parent can't miss work, and there are a lot of parents out there that they can't just get off in the middle of the day to drive and get a child to go to the doctor to miss 2 to 3 hours to get back to work. It just doesn't work for them that way. As a nurse on a 12-hour shift, I couldn't just leave at 2 o'clock to go take my child to the doctor to come back at 4 or 5 o'clock to finish out my shift. I have patients to care for. It's not something I can do. The one good thing about my job, or back in the day when I was in there, is I worked the 3 to 4 days a week. So I had a day off here and there that I could schedule appointments and that kind of stuff. But what's so great about having this is the students don't miss class. And that's one of the things we don't want. We need them to maintain and be in class, learning, getting their studies done. My students, I'm sure, are rolling their eyes as they look at this picture, but it's great. One of the things that this chapter really breaks down is the primary prevention, secondary prevention, tertiary prevention. Primary health promotion activities, teaching healthy lifestyles, immunizing children for school entry. We don't give the immunizations, but we make sure as school nurses that the immunizations are current. If a child doesn't have an immunization, you've been reaching out to the parents, what should you do? You should continue to reach out to parents, definitely. Should you make the child go home until they get it and not come back? No, because we don't want them to miss school. There's something going on. Why? You want to see, is it they don't have health insurance? And if that's the case, as the school nurse, then we need to connect them to get the help that's needed. Go through the health department or whatever needs to happen for that child to get immunized. do they not have the time to take them? Like they're unable to get them there for appointments. And then intervene again. We're there for this child, we're there for the parent when it comes to immunizing children for school entry. The other thing is as we go through, we'll talk about primary, secondary, and tertiary prevention. Caring for chronic health problems, health referrals, and continuity of care is tertiary, but secondary prevention is screening for health problems, caring for ill or injured children and staff. One thing that I wish that this slide had on there is under secondary prevention, we do request, or the school nurse, secondary prevention would be to request for the child to go for a doctor's appointment. So if we're screening for health problems, we come across one, then we would refer them to the physician's office for this to be looked in further. I did a scoliosis check back, passed it at school, but my mother was concerned about my posture. But if it had been identified at the school, the nurse or the school system would have then referred me, and that would be secondary prevention. Just want to make that kind of clear. Even though, and what to me is kind of confusing, and it could be just me, but looking at this, the tertiary prevention is health referrals. A referral is different than it. Well, let me take that back. We're screening for health problems. So if we're screening and then we're going to send them to the physician is what we would do. Just remember that as part of the secondary prevention. Health referrals and continuity of care is a little bit different. We're going to refer to like a nutritionist or something. We'll go a little further in detail here as we go along, and I'll bring back this picture. Information you need to know. Injuries are the #1 cause of death among children and teenagers. One of the things about children, and especially teenagers, let's go with that, is they don't think they're going to get injured. They don't fear injury. So they think it's not going to happen to me, right? It's that mentality, but it is the #1 cause of death, unfortunately. So as a school nurse, as a community, as a parent, as a person watching something, we need to understand that. So if we see something happening, we need to intervene. There should be a plan, and others should know what to do if the nurse is not available. And the plan is an emergency plan. There should be a plan of care, an emergency care plan, and everybody needs to know it. Teachers, staff, people need to know what to do if there's an emergency. Unfortunately, with funding, there's not a nurse at every school. There might be a nurse in the district, and that nurse goes one Monday, we're at this school, Tuesday, we're at this school. So if they're at this school on Tuesday, and the school that they were on Monday has an emergency on Tuesday, there's no nurse there. So the teachers, the faculty, the staff, everybody needs to know the emergency plan, be able to access it, and be able to implement or do whatever is needed during that time or that crisis. Any suspected abuse must be reported to the authorities. If a child comes to the school nurse and is telling about another student who's being abused at home, they saw the marks, as the nurse, school nurse, just like a nurse in an ER, just like a nurse in a clinic, just like a nurse anywhere, we must report it to the proper authorities. We cannot ignore it. Unfortunately, it has happened in our world. Unfortunately, in our country, it has happened where abuse was reported to someone, teacher, nurse, and then was never reported any further, and that child ended up with much harm. So it is so important that you understand that. School nurses do check for lice. I threw this one in here because I saw that. Both my parents were in the educational system, but they do check for lice. And I want you to understand, it has nothing to do with socioeconomic status. Lice has nothing to do. A louse will go from one person to another, as long as they can connect to a hair shaft, and the warmth of the body is what will hatch a knit. That's the little egg sac that attaches to the hair. It's a little white knit, and that's what has to come out. So a lot of people get freaked out about it. And I'll just go ahead and personally share, like I always do in my classes too. I did have lice one time. It wasn't due to any of my children or anything with the school system. I was at a movie theater, and I laid my head against those old material chairs, and I got lice from it. There was an outbreak there. So they had to end up spraying down. Somebody who had lice sat in the same chair, and it was just on there, and I laid my head back, and of course I got lice. And of course I was a nurse, so I went home and bought all the stuff, excuse me, that I needed to treat myself. But school nurses do check for lice. Mistakes can be made. There's a lot looking at this. Is should a nurse check a class? All, everybody in the class checking everybody because of kids being bullied, privacy, different things like that. But we still check for it. So if a student came, had head itching, we might do a louse check or a lice check. Yuck. itchy, now I itch. Always assess. I put 3 exclamation points there. If something happens in the community, continue to assess for shock, stress. Things happen. You might have, a factory or something blow up in the community that killed a parent or injured a parent or just caused the parents not to have jobs anymore. They're always assessing for shock. You need to do it if there is an actual tragedy that happens in the system, in the school itself. It's always assessing for shock and stress, always looking for those things, because once we assess, if we identify, then we would need to address the problem accordingly. Somebody might need to have true counseling. Some people might need just to go to their church, or some people might need money or funding to help in the situation. So always assess, nursing process, right? Asthma. Asthma is the leading cause of missed school days. It's a chronic illness. It's in children. A lot of children outgrow asthma, but it is the leading cause of missed school days. So if we can control asthma, if we can make sure things go well, if there's an issue, we can administer an inhaler or something for the student, that is great. We don't want them to go into a full-blown asthmatic attack. We would like to hopefully intervene or prevent, right? The school nurse should keep track of the indoor air quality. It is something that also falls onto the nursing plate. And you're thinking, why that? Well, a lot of things happen. I mean, if you're in a painting class and they're painting with a specific kind of paint that has, fumes or some type of odor that could trigger. If you're in a shop class and there's a lot of dust, where they're sanding or doing something, this can all affect indoor air quality. So the nurse needs to keep track, understand, because this is all preventative. If we can keep our air quality, if they're going to do something, they need to open the windows, the doors. If we need to provide fans, different things to help the air quality be better during the time of whatever's going on, then that's what we need to do. And that's where it falls into the nurse keeping track of indoor air quality. She needs to know if this happens, then policies, procedures, things like that for the shop teacher. If you're going to sand whatever today, please make sure you open all doors, windows, the whole thing. Maybe help, take fans so that you can push air out instead of allowing air to stay in, bad air. The tertiary prevention is administering inhalers or asthma rescue medications. That is a tertiary prevention, is administering these inhalers or asthma rescue medications. Teaching everyone about allergens and how to reduce them in the classroom. That goes back to that shop teacher or someone else. Advocating for safer cleaning solutions and safe storage for these products. There are products out there that people don't realize, if you don't have allergies, that people use, and they can actually trigger a whole severe asthmatic attack or an allergic reaction to someone that can create airway issues too. But so we want to make sure that we have good, safe cleaning product solutions, and then we store them safely. And that's so that we don't have a problem. There was a teacher I worked with, and whatever cleaning product they used on the tables, it would trigger her asthma. She had an allergic reaction to it, and she would start to have breathing difficulties and have to use her inhaler and stuff. So we had to request that product not be used in the classroom, because every time it triggered her. So things to know about asthma. Diabetes. I teach on diabetes, I harp on diabetes, and I'm going to teach it again in the school nursing role. Diabetes, it's a silent killer. We know that the damage that happens, it, affects the eyes, the kidneys, it affects all major organs. I mean, and until things start to go down south, until you start to have issues, you don't really know. A lot of people don't know they have diabetes, and you wouldn't think it with children. Type 1 is the one that's usually that we used to only see in children, and now we're seeing type 2 in children. And so we need to really think and look at things. The most prevalent chronic diseases in children and adolescents is diabetes. We need to know as the nurse how to respond to hyper and hypoglycemic emergencies. If we need to give insulins, if we need to give medications, whatever, we need to understand in what we're doing, what to look for. If I give something, I need to know as a nurse that in 30 minutes, I need to check this person again. In an hour, I need to check them again. In 3 to 4 hours, they're going to have, a low, let's say. So I need to make sure I understand what I'm giving. It goes back to having that drug book that's current. If I'm not aware or know what I'm doing, I can at least look it up to refresh my memory. Special nutritional needs, meals and snacks, that can be very difficult because some families can't provide those meals for their child. And so then we need to work with dietary, we need to work with the lunch room and make sure, and then have snacks on standby. Let teachers know, staff know that if there's a child that is a brittle diabetic and they start to become diaphoretic and they look like they're having a hypoglycemic emergency, these are the signs and symptoms, and this is what I'm going to give. What kind of snack? If they can't talk, if they're unconscious or they're semi-unconscious or semi-conscious, I should say, do not put anything in their mouth. But there are tablets, there's gels, there's a lot of things we can do. And 911 is always needs to be called in these situations. Administering insulin and monitoring blood glucose levels, something we need to understand how to do it and when to do it and why we're doing it as school nurses. It would be ordered by a physician. We would still need to have that written, directions written out, but it is something that they do. A lot of this can be very time consuming. So think about all the different roles that the school nurse does. And then on top of it, this, so it's kind of interesting just how much is needed by the nurse. Things to know: it is tertiary to help with pregnant teens ongoing care as well as coordinate care outside of school. You would think that would be primary when you're looking at primary, secondary, tertiary, but I wanted to just make sure you understand this is a tertiary because they are high risk. Pregnant teens are high risk, period. I don't care if you come from one side to the other, if you have no money or if you have $1 million. Whatever the situation, if you're a pregnant teen, you are considered a high risk patient or client. And so that is tertiary care, to make sure that they're having ongoing care at school, that we're providing what's needed for them, if it's meals, if it's counseling, the mental health piece, whatever. We need to make sure that there's ongoing care, plus to coordinate care outside so that they're going to an OBGYN, they're being examined, they're taking prenatal vitamins, all the things that are needed, because being a high risk, it's not good. And then also post, after they have the baby, we need to continue with this care and continue, because being a parent doesn't end once that happens. The other thing I want you to know is if it goes against your belief system, always step away. If there's something going on and it's something you just can't, there's several things, especially with women's health care now, that a lot of people have strong beliefs on. If that's the case, step away. But the thing about stepping away is you can't just say, I can't, no, I'm not going to do it. You have to ask another nurse to step in to provide the care. So you would need to then take the steps to make sure someone is filling in to that, your footsteps, take yourself out and put someone else in so that they can get it done. You can't just try to manipulate or do something to alter or change people's feelings or thoughts. You have to provide for them and what they need. And it can be difficult. So one of the things I tell my students all the time is understand yourself, understand your own thoughts and beliefs. You have to know you so that then you can take you and sometimes set it to the side to provide care. And sometimes if you can't, then to step away and let someone else. Because that is critical thinking. That is adult thinking. It is so important. So just something that I want you to know. The future deals with, just so you know, our future deals with computer and technology skills. Is that not the truth? For nursing, the future of nursing, period, and anything is understanding technology. You're going to have to beef up your computer and technology skills. We use computers for everything. We're now using equipment that is highly technical. So you just have to be able to adapt and adopt. We are becoming a society, or have become a society of that. And now it's getting even more intricate and more difficult. So the future deals with that, and we need to understand that. Also, looking at that, I want to say is also think about if you're dealing with people who don't have internet, who don't have computers, who only have a phone and their phone can't support certain things. It's really great on paper to say, this is what we need. This is what's, oh, you have access to this and this and this. Well, you only have access if you have a computer and you have internet. And then there are areas that we live in here in the mountains that you can have all the money in the world, but you don't have internet all the time. So it's something to think about and understand. Always thinking, always asking, always assessing. It is so important. Just so you know, schools are mandated to make provisions for any student with special health care accommodations. This is a federal government mandate. So if you have someone that comes in and gets diagnosed with something that's going to take a lot of care or specialized care, you can't just say, sorry, you can't go to our school. We can't do it. That doesn't work. Government says, yeah, sorry, especially for a public, federally governed, supplemented school. You can't. By law, you have to provide the care that's needed. You'll have to figure it out and make it happen, working with the parents, working with the physicians, working with the school itself, and then working with outside resources. But we're mandated to make provisions for any student with special health care accommodations. CDC and Prevention school health programs, prevention school health programs. They make sure that the school is a healthy environment always. We need to make sure that there is a healthy environment, not only physically, mentally, it needs to be healthy. Help teachers with health-related education. The school nurse will step in and help teachers with health-related education. And sometimes the teacher will have the nurse educate themselves, and sometimes they just have the nurse as a resource. Teach nutrition and encourage nutritious choices. So important. We need to teach them what to eat and how to eat. And then to make those choices, we need to be able to hopefully help with that. With Healthy People 2030, obesity, childhood obesity is huge. So we really need to be working and looking, because we can prevent so many diseases if we can promote nutrition. Provide mental health counseling, huge. When a child turns 16, a student with multiple disabilities must still have an updated individualized educational plan and will continue their educational journey. Just because a child turns 16, if they have disabilities, multiple disabilities or disabilities, they will not be just turned out to the street. Sorry, Charlie, we can't do. No, they have to have an updated plan, and we continue with their educational journey until they reach their destination in their educational plan. So I'm going to stop my share. I'm back. One of the things I want you to get is when you go through really looking at primary, secondary, and tertiary, don't get real confused. It can be confusing. I do want to look at a couple things real quick before I jump off, to make sure that we're all on the same page here. Always being there. You want to be the resource for the parent. The parent, they might lose their immunization card. They might lose their insurance card. Things happen. If you have a lot of children, it can be very difficult to find this, that, and the other, but you want to help them. The other thing that I found very interesting, being an old ER nurse, trauma nurse flight nurse is that the school nurse has numerous things in their emergency kit accessible for them if there's an emergency. And I wanted to find that. It's straight out of the book. Here it is. Additional supplies for school nurse, C-spine immobilizers. We talked about that. Glucose monitoring device in case you're not sure if they're having a low blood sugar, you can at least check it. Medications, albuterol, epi, oxygen nebulizers, pen light, self-inflating resuscitation device, stethoscope, a blood pressure cuff, and suction equipment. It can be even just a bulb vac, like we do with babies. I thought that was very interesting. That they say this is something we should have. I didn't realize that school nurses had that. I don't think all do. I think it's based on policy and within the schools of what is developed, what is policy, and what has happened. But always remember, in any emergency situation, we always call 911 first, just like we would do if we were out in the grocery store and someone went down. And but if we have the supplies, the nurse must be present with these supplies. But these are the ones that the nurse is present. If you don't need a nurse, you can have CPR, AED supplies are stored, automated, those are the automated external defibrillators, ice, cold packs, all of that. There's a big list. It's on for my students, page 563. So kind of look through those. Think about this. If I have C-spine, glucose, these are things that you've been trained, skills you're trained on. I wouldn't exactly think those would be something that a nurse would need. The nurse needs to be responsible for these. So I wish everybody a happy Halloween tomorrow. I'm in class getting a test for students. Trick or treat tomorrow. We'll see. I hope this helps. Have a great day.